Professor Brown, the politicians have been telling us all along that because we are rural and we're small and we don't have huge populations, we will not feel the effects of this ill-informed policy.
Competitive bidding, as it's written, is supposed to apply to these large metropolitan areas. In fact, I believe it's not supposed to apply to any areas, any metro areas under 500,000 people. Okay. So it appears then that some of the rural states, Iowa, North Dakota, West Virginia, that these states are going to be unaffected by competitive bidding. And for a long time, it was, in fact, difficult to get any of the politicians in these states to recognize the problems that were probably going to filter through to their states. I've been working on some research in this area over the last year or so, and what's clear is that many of the branch offices in these rural states are actually branches of these couple of national companies that Mike mentioned. When these national companies are forced to submit low bids in these major cities, they're going to have some financial difficulties. In fact, most of these companies are already having severe financial difficulties. One of the companies has lost hundreds of millions of dollars over the last few years. We would probably say that they're bankrupt. Yet in the bidding process that's taken place already in these 10 cities, they've been willing to bid a price something on the order of 33% below what they're currently getting for these products. And so it seems very clear to me that if you have a company that's already losing hundreds of millions of dollars, they can't survive another 33% cut, and it's likely that they're going to fail. What the thing I think that has been missed here, the concept that's been missed, is that when that company fails, it's not only going to fail in the big city, it's going to fail all across the country. It's going to fail everywhere. Okay. So if Iowa has branch offices of that company, those branch offices are going to close. And the research that I've done has looked at how many branch offices in these rural states are of these national companies, and there's quite a few, in fact. And if you take those branch offices that are likely to fail, and by the way, as Mike pointed out, many of these providers are community-based, locally owned providers. If the big guy can't survive in this environment, when they've got the opportunity to buy on a large scale and take advantage of a home office that these little guys can't always take advantage of, I think that some of them are in financial distress as well. So my research suggests that there might be on the order in these rural states of maybe 40 to 50% of these branch offices and providers closing over the next few years.
Wow. Where does that leave the Medicare beneficiary and the frail elderly? Kelly, I know that in your position, you reach out to many people in the disabled community. What are the people you talk to saying about this impending doom?
It's a mixed bag of emotions. For a lot of people, they're confused how our government could set policies into place that would affect them getting the necessary equipment and services that they need for their care. They're fearful that if they don't get the equipment and services for their care, they're going to either be confined to a bed in their home or in the hospital longer, or worst case scenario, in a nursing facility and away from their families, and that's definitely what they don't want. And they're angry, because believe it or not, there's some people out there that aren't even aware that this is going on until we talk to them, and so they are just can't believe what's going on once we tell them And they are very emotional and angry, which hopefully what I think is going to happen, or what I hope is happening, is that they're going to advocate for themselves and for the home care industry to help us ensure that those services and equipment stay out there and available for them.
I believe you introduced me to Angie Plager. Could you fill us in a little
Sure.
bit on her situation?
Sure. I've been very, very fortunate to actually meet Angie Plager. She is a 27-year-old woman who was in a car accident in 2003 and left her paraplegic and in a wheelchair for life. And we were able to sit down and have a conversation with her, and hopefully we can have a look at what she has to say in her own words.
My wheelchair there's no word to describe how important it is. It is me. It's like I mean, I'm not glued to it, but I might as well be. It is me. It's like it's like a limb. I mean, it's who I am. It's how I go anywhere. It's how I function. It is, my legs don't work, so I use wheels. As long as your equipment works, you're not really disabled. I mean, honestly, it's like I'm very functional. I'm out in the world, probably more than the world wants me to be out there, but it's just like I have a chair and I've got a van. I've got, between that and a cell phone, what else do you need? It's like you're good to go. Your equipment works and you're not really disabled if your equipment's good. Not only is the piece of equipment, the wheelchair, very vital, so is the people who provide it to me and the service that they give me. They go out of their way for all of their customers, because they know how important it is. An example of that would be all my grandparents were over and we were having dinner. It was a Friday night and it was like 4:30, and all of a sudden my joystick just shorted out and I'm sitting about right here in the middle of my living room. So I call up my company and I'm like, hey, do you got a few minutes? So they actually drove 35 miles out here, gave me a loaner joystick to get me through the weekend, and then I went and saw them Monday morning and we got it all figured out. And I mean, they were amazing. I was just like, because they know like how important it is, and by them doing that, I didn't have to be in bed all weekend, and I could have dinner with my family, and then I could, have those plans that I had the rest of the weekend, and so it's just amazing.